Good good afternoon, good evening, and welcome everybody. On behalf of the International Institute for Environment and Development and all our partners, thank you for joining us today.
So, a very warm welcome to all of you. And I'm Ritu Bharadwaj. I'm the Director, Climate Resilience, Finance and Loss and Damage at IIED. And I also lead a work program called All Act, so Alliance for Locally Led Action on Loss and Damage. It has representation from more than 50 governments and 70 plus grassroots organizations where all the organizations or different types of stakeholders, they have an equal platform. So this is a research that we have done, too hot to work, too poor to stop. This is something that we have done in partnership with grassroots organizations and several of our. So I see Tom Mitchell has just joined. So Tom, we just started off, but maybe I'll hand it over to you to give some brief introductory remarks.
Yeah, welcome everybody. Delighted to see you on this call and thanks for making the time. I just wanted to thank Ritu and the team for the kind of the work that they've been doing to kind of prepare this report and also for the coverage it's received. I think you will appreciate that there's some very kind of serious and sobering findings that we're going to be sharing today that have also, I think, started to raise some big questions about how kind of whole economies are being impacted by extreme heat, but also how that boils down to individual experiences, and some really challenging individual experiences that can often have multi-layered and quite difficult and intersecting impacts within families, within individual people's health, within areas of physiological impact that you don't necessarily immediately pick up when you think about extreme heat. And also the really tough choices that people are having to make day to day about, where their workplace is. Is it open? Have you got access to water? Have you got access to sanitary facilities? What are the adaptations that are possible? And equally, what are the rules around dealing with extreme heat in the workplace? Now, of course, this is research that's focused on India, but I'm sure that in many places, and people on this call are, of course, working on these topics in very many different places around the world. These will be topics that are all too familiar to you. So I'm very much hoping that during the conversation today, we can hear from a range of experts and people giving kind of commentary and insights where we can gather some of the experiences of what are the practical approaches that we can take to support and deal with some of the very localized and individual experiences of extreme heat, but also how can we raise this up to be policy topics that can gain very significant attention and action now, where pooling that experience is so vital. So just wanting to confirm that IIED is an organization, we are a research body, but we want to make sure that our research turns into practical policy-driven solutions, but also makes a difference to people at the front line of these challenges. We do work on extreme heat, and particularly in the context of cities all around the world. But it's something that we're going to continue to be committed to do, particularly looking at the intersection with health and with work and so on. So this is a body of work that we're very much committed to, and look forward to working with many of you on the call as we take this agenda forward, certainly given its seriousness and presence in everyday lives. Thank you.
Thank you, Tom, for those introductory remarks. And I'm not going to take too much time, and I'm going to straight away dive into the findings that on the basis of which we are going to have some good discussions today. We are also very thankful to all our panelists who have joined today. So, I'll and we are very, very thankful to them because this is an issue. And as Tom was mentioning, it's about psychological impact. It's about the health impact that these workers are facing. So it was not very easy for these workers to come and share their experiences. And we're very thankful to our partners like Change Alliance, OCOP, and a couple of other organizations that you see there. They're absolute grassroots organizations working with the workers. And that enabled them to open up and share their experiences with us. We are also very thankful to five of the doctors who worked very closely with us, not only in the design of this research, but also in the way in which the data was analyzed and how we came out with some of the findings that we did. So I'm going to straight away dive into what this research is. We covered this research in 4 cities, 3 in India and 1 in Bangladesh. Today, we are only launching the paper related to India. The Bangladesh paper would be launched later in this month. We surveyed close to 700 plus households, and some of the areas that we tried to cover through this, we didn't want to repeat what many of the other organizations have already done, because these days research funding is very limited and we don't want to over research the same thing which we already know. And therefore we wanted to focus this research more into trying to understand uh, like some of the under researched area. Now, we typically, when we talk about extreme heat, we only think about outdoor workers. We don't really think that the indoor workers might probably be exposed as much as the outdoor workers. And I see, I think, is somehow can you still see my screen there? Yep, okay. And the second thing we wanted to highlight was to understand the extent to which it's not just the health impact on the bodies, but also the non-economic loss and damage that these workers are facing. And the third was around how much is, like, we also typically think that the workers are only exposed to heat at their work site. When they come back into their living spaces, probably the impact of heat is not that experienced. We also wanted to understand that. Plus, combined with all of this research, we wanted to come out with very practical solutions. Something that Tom mentioned, that we are a research organization, but at the same time, we don't just want our research to sit in some paper or some journal somewhere, but we really want to some of these research outputs to be actioned upon. And that's something that we'll be discussing later on with some of our esteemed panelists. Now, this is the way in which we have designed our research. We are not just looking at the precipitating factor, we are not just looking at the heat impact, but we are also very much looking into the predisposing factor. What are the conditions around the heat that really makes the workers more vulnerable to being exposed? And then broadly, we covered the housing condition, the social drivers, the occupational drivers, the economic demographic drivers, but also to what extent are workers themselves trying to cope with this heat, and to what extent there's a lack of social protection around them, which really makes them more and more vulnerable to the range of impacts that they typically face. Now, let's just first very quickly go through the precipitating factor. Now, this is the average annual mean temperature. And you can see we started analyzing the data right from 1901. So more than 125 years of data. And you can see the average annual mean temperatures increased by more than 1 degrees. But more important to see is this temperature anomaly. Now, temperature anomaly, as you will see, has increased more in the last 2 decades. And similarly, the maximum temperature has increased. Why maximum temperature analysis was important? Because for for us to understand the extent to which a worker through the day experiences the height of temperature throughout that day. And also, again, here you will see the maximum temperature anomaly. Now, we typically think about 2024 is the year that we remember as being the hottest in India. But I think if you look at this data, 2016 was another year which was extremely high peak. Now, for the predisposing factors, we try to analyze who are these informal workers who typically work in cities. And in what it worked out was, this was a random sampling. So what it worked out was outdoor workers, close to 90% were migrant workers, and indoor, close to 77%. And many of them, they migrated with their families. So you'll see a lot of children migrating with them as well. But most interesting thing is to see here is that majority of these migrants started migration only in the last 5 years. And something that I've not presented in the slide here is, if you go and ask them the reason as to why they migrated, behind that is a failed crop so to a large extent, it is the climate risk that has pushed them from many of these rural areas into these urban informal settlements. And because they are migrant workers, it becomes even more important to understand their predisposing factor, because many of them, they stay in informal settlement, they don't have a permanent households. And that is why we looked into this housing heat exposure index. And this is made up of a number of factors, for example, roof type, roof height, per capita housing area, and so on. And I'm not going to take you through too much in detail with this, but basically, what you will see is in many contexts, the roof type is mostly tin, tarpaulin, which barely protects them any, provides them any protection. Then again, the roof height is very low because heat typically rises on the top, and if it has no space to escape or it basically stays within the living space of the people. Again, we looked at the wall type, per capita housing area. Again, in one single room, there are like 5 or 10 people staying together. Availability of fans, you'll see close to one third don't have a fan, and even those who have fan, there's just one fan. There's no refrigerator. But what it does is you will see that the food security issue really increases around the summer months. Why? Because a lot of food gets spoiled. But more than that, it's also because of lack of wages. The people don't find work a lot during the peak summer months, and that is why you will see the food insecurity issues goes up. Again, water availability typically in summer is an issue, and also toilet facilities at home. In terms of protective factor, which could have brought down some of the impact that the workers are suffering, you will see on a scale of 1 to 10, typically the social protection index is less than 3 or 3 or around 3. And this is when, if you look at the food aid program in India, it's probably the best in the world. Like when I say best, the amount of money that the government spends on this, plus India is probably the only country where you have the one nation, one ration card program, where workers can avail their ration or ration from anywhere. It does not matter whether they're migrants or non-migrants. But still, you will see a third, or in some cases, around 40% of the households don't even have coverage, or they don't have access to those cards. Even those who have cards are not able to avail it. Similarly, is in the case of health facility. India, again, I would say, is I do a lot of work on social protection programs, and I've reviewed a lot of programs globally as well. India's health program, especially the Ayushman Bharat cashless program, allows people to go and seek benefit or seek treatment, cashless treatment, even from private hospitals. But you will see a lot of people are not aware of them. They don't have those cards. And even if they have those cards, they're not able to go and avail those facilities. Similarly, there's a labor welfare scheme enrollment, e-shram enrollment. You will see a lot of the workers do not either are not aware of them or they don't have access to them. Now, this is again the workplace heat exposure index. So, to what extent workplace facilities help workers cope with the heat conditions? On a scale of 0 to 10, it is less than 3. The indoor workers are slightly better off than outdoor workers, but they're actually not that great. And some of the ways in which we have tried to understand this is the daily working hours. You will see both for outdoor and indoor workers. For indoor workers, is slightly longer. The work day is more than 9 hours. And again, availability of shaded workspace, cool water, electrolyte is almost negligible. There's no medical provision, but also there are ways in which the exposure to extreme heat can be regulated. For example, ban on midday work, job rotation, work schedule changes, but none of that is happening right now. Again, quality of toilet facility at work becomes important because a lot of workers who we interviewed said they didn't drink water because there was no toilet facility, especially for women. And that you can understand has an even more damaging impact. Now, workers try out different hacks or try out different ways in which they can deal with the impact of heat. And but again, you will see on a scale of 0 to 10, it stays less than halfway mark. There are different ways in which they try to adjust, like rest in shade, cover the head with cloth, avoid carry water to workplaces, and so on. But all of that, I'm not spending too much time because it's quite given a lot. Anyone who stays in India or Bangladesh or has seen many of these areas, they would know that this is kind of a given. But what we don't really know is the health impact. And to understand the health impact, we looked into three category of impacts. One was heat. So there, and this is not us, like we are not the experts in the health area. So that panel of doctors who really helped us analyze this data, they explained to us that there are three types of health impact that can come in. Now, it starts with a lower, like heat cramp is the most common, but if it becomes more pronounced, like then it can lead to heat exhaustion, and from there it can lead to heat stroke. And heat stroke probably is the worst kind of impact that they can suffer, and that leads to acute kidney injury in case of many workers, and repeated exposure to dehydration can then lead to chronic kidney disease. Now, we try to understand the level to which the workers are exposed to this heat cramp, heat exhaustion, heat stroke, and how many of them are suffering from AKI and chronic kidney disease. Now, heat cramp, again, these are some of the symptoms of them. Uh, these are the share of workers. You will see that, you know, less than 14-15% are actually seeking medical care for these symptoms, and this is the heat stress prevalence index. So on a scale to 0 to 10, 8.99, like close to 90% of the workers indoor and outdoor are suffering from heat cramps. Now, the second stage of this impact is heat exhaustion. Now, these are the symptoms of heat exhaustion, and we then looked into how much of the workers are actually suffering from heat exhaustion in summer and then the non-summer months. Now, and this is the scale at which, or estimate of the workers who are actually um, seeking any kind of medical attention for the impact that they're suffering. You will see close to a third of the workers, even if they are suffering, they are not seeking any medical help for that. Now, the worst form of heat related damage is heat stroke. And this is the scale at which it is happening, which is 54% of outdoor and 51% of indoor workers are suffering from heat stroke related symptoms. And of that, those who are actually seeking help in terms of outdoor is close to 20%. Again, in case of indoors, it is close to 19%. Now, heat score prevalence index, this is something that we developed just to understand the scale of damage. So you can see in the summer month, on a scale of 10, it is around 5. Again, in case of outdoor, is 5.42. In the rest of the year, it goes down, which is quite understandable. But that's the scale at which workers are suffering from heat cramps, heat exhaustion, and heat stroke. Heat stroke is almost a medical emergency. And that is what we were told. Uh, Now, we also try to understand what are the factors that really contribute to that. So, is it just the heat exposure, or is it a range of other factors? And for that, we developed a regression model. And I have my colleague joining later in the panel discussion who will explain what this regression model output really means. We also try to understand that beyond the physical health damage, what are the psychological impact that the workers are suffering? Now, some of the ways in which we try to develop this psychological stress index was to understand the increase, and this is how the workers themselves explain irritability, being angry, mentally tired, feeling sad, hopeless, having not being able to sleep properly. And these are some of the factors that really stood out very strongly. And we also compared it with non-summer months, and it was very clear that it went down in non-summer months compared to the summer or during the period of extreme heat. We we have we did all of this analysis on a toolkit called CSIC, so comprehensive.
Sorry, Ritu, apologies. People are asking you to slow down in the chat. Sorry.
Okay. So we used, thanks, Marcella. So we used something called CSIC. So CSIC is a comprehensive climate impact quantification toolkit where we try to understand the tangible, intangible, intrinsic, and functional damage that climate impacts create. And we use the same framework to identify the heat impact on the workers. Of course, you will see a lot of this explained in greater detail in the paper that my colleague must have shared in the chat. But we'll have more discussion around this in the panel. So I'm sorry for being a bit fast because we have one of the panelists who has to leave early. So I'm making sure that we get a chance to hear from him as well. But this is where I would really want you to focus. So what are the longer term wage and heat related kidney disease that workers are suffering from. And here I've presented both India and Bangladesh data. So this is, if you remember, I had mentioned about heat cramps, heat exhaustion, and heat stroke. And in India, the workers who are suffering from AKI turns out to be around 18.67% of the total workers, which is quite high if you ask me. Bangladesh is around 23%. Now, in terms of the estimated percentage of the workers who I wouldn't say graduate or who go from AKI, acute kidney injury, to chronic kidney disease. In India, it is around 4.82. Now, you might feel that 4.82 is a very small percentage, but this is a medical emergency. This is where their kidney almost gets damaged and they might need dialysis. Now, you can understand a worker going to that stage means that they will not be able to earn a decent or a regular living anymore. Now, number of workers that it translates into, and this is something that we projected based on our data, is around 26.35 million workers might be suffering from CKD purely because of heat-related exposure. Now, the wages lost because of exposure to CKD in terms of million is around 4,507 million in India, and of course 607 in Bangladesh. And in terms of the wage earning lost in billions, in purely in amount, in India is close to 22.73 billion. That is a huge amount. We then translated that amount into what does it really mean in terms of GDP loss. So in India, that GDP loss purely from CKD, chronic kidney disease, comes to around 0.58% of GDP. India is a big economy. You can imagine how much that really means. Now, beyond the health related damage, we also try to work out the work days and wages lost during extreme heat events. So we try to calculate it on the basis of three parameters. One is work days missed because of heat related illnesses, work days lost because of inefficient working because they can't work with the same efficiency. And the third is around a lot of workers complain that because of extreme heat and they are daily wage earners, a lot of construction sites are closed because of regulations and therefore they can't even find work. So combining all three, the average amount of work days which are lost due to extreme heat for outdoor workers, it comes to around 24.3 days, and for indoor workers, around 14.8 days. And in terms of the wages lost per year is around $151, and for indoor around $89. Now, those of us who stay in Europe or UK, this amount might seem very small, but for a daily wage earner, this is a huge amount of money. And this is the level, as it is, many of these workers are living below the living wage. But this heat related damages leads to even more decrease in that living wage that they suffer. Now, if you, like earlier, I showed to you that close to 0.58% of GDP is lost because of health related issues. But if you combine all of this, India's loss of GDP purely because of extreme heat is around 1.99%, which is close to 2%. In case of Bangladesh, although the report would be published later on in this month, it comes to around 1.38%. Now, we just didn't want to highlight the issue. We also wanted to share the solutions with you. And the solutions are actually within reach of India. And that is because India already has some extremely good, as I say, the systems already in place. India has Aadhaar card, there's an e-Shram registration. Almost most of the households have a bank account which is linked to Aadhaar card. So we already have that systems in place. What we are saying is that if you look at and majority of these losses are concentrated in 13 states in India, and which, if you only look at the amount of workers which are exposed to extreme heat, it is around 350 million. And if you, like currently in those 13 states, 350 million workers are losing close to 36.36 billion dollar per year. But if we were to provide them coverage through a cash transfer program, And for this, we have worked out three models. We have taken the average wage based on the MGNREGS program, which is India's public works-based social protection program. So if you look, if and there the average with the wage floor is around $3.15. So if you take that into account, and in a normal year, based on the IMD projection, the heat days, the extreme heat days, comes to around 4 to 7 days. So we have taken 6 days there for a normal year. In a very hot year, it can go up to 11 to 12 days. So we have the second model is around 12 days, and in a record year, it could go up to 18 days. So what we are saying is that in a normal and hot year, that 6 or 12 days of wage should be paid to the workers so that they can stop working in those extreme heat days and stop causing themselves permanent loss and damage that they suffer on their body and their mental health. But in case of record year, when it goes up to like 17, 18 days of extreme heat, then that extra days can come from insurance. And this is based on some of the experiences that we have learned from India's SEVA model. And we have Claire coming in later in the panel discussion, and she can explain more about it. What we are saying is that do not use insurance as the only way in which workers can be compensated. Because if you only look at the insurance payout, then it hardly covers $7 to $8, which is like a very small percentage of what workers actually lose. But if you combine it with cash transfer, then you can provide a much better coverage so that workers can actually stop working. And what we are saying is that, they should be on a living wage modeling approach. There should be a heat triggered cash transfer. Uh, Workers should be provided support to get better access to Ayushman Bharat PDS scheme so that the total, if all of these measures are combined, then in a hot year, the total expenditure that comes to is around 1.45. On cash transfer alone, 1.33 billion, but that is nothing compared to what workers actually lose. And we have our own analysis which also shows that for every $1 that is spent in early action, you can actually reap a benefit of about $5. So why not do that, and rather than letting these workers face that loss and damage on their body? India also very recently they came up with a revision in their labor laws where 13 different obsolete laws were combined together into one law. But what we really urge the government is to also introduce a heat related thresholds in the code so that workers can be allowed to stop work when it goes beyond a certain threshold. Then also, like right now, those regulations are only applicable to workplaces above a certain threshold of workers' count, but heat impacts each and every worker, and there's so it should not be based on the worker count, rather based on hazard based approach. So the moment heat goes above a certain threshold, this regulation should come into action. And then again, we are urging that heat stroke and other heat related illnesses should be considered as an occupational disease, because right now the state insurance program does not recognize heat stroke or heat related illnesses as an occupational disease. So I know I went a little bit fast, and apologies for that if you have not been able to follow all the findings. But my colleague has shared link to the paper, and we'll be hearing more from the panelists as well. So you'll get a chance to understand some of these issues in greater detail. But with that, I will really request if we still have Dr. Krishna Vats, and we are very thankful for him to be joining us today. He is the member and the head of department for the National Disaster Management Authority in India. And if we still have him, I would really request him to come and give his opening remarks. I know he had to leave, and that's why I was going a little bit fast. Chandra, can you just confirm if Dr. Vatsa is still there?
No, Ritu, I can't see him in the meeting room yet.
Okay. I'm really sorry, colleagues. I tried my best. He had sent me a message that he had to leave earlier. We are very sorry to have him go, but maybe if he is able to join in later on, then we can have some of his comments. But I'll start off with the first panel, and we are really thankful for four of very esteemed panelists to be joining us today, and all of them are experts in their own field. We have Mandakini Baldhohi, who's the Director Insurance, Ministry of Finance in India. We have Madeleine Thomson, who's the Head of Climate Impacts and Adaptation at Wellcome Trust. We have Bart van der Hurk, who's Scientific Director and the co-chair of IPCC Working Group 2. And we have Claire Harbron, who is the Chief Executive Officer of the Howden Foundation. Almost all of them have extensive work in the heat space. I'm very pleased that we have them with us. So probably I'll start off with you, Madeleine, if you're okay. Is because I know I've been very closely associated with the Climate Health Impact Awards initiative that you have. And we know that, and in most of my own work, I keep saying that we do need to put numbers on these impact, because without putting numbers, it really loses the attention of the policymakers. So from your experience, Madeleine, how do you really see that the importance of some of these findings coming on the table, and how do you really see these evidence influencing real action in the policy space, and especially the kind of social protection programs that we've been demanding for the workers who are exposed to these extreme heat and suffering with their bodies?
So thank you so much, and it's just a pleasure to be here. I think what struck me most about the report is really how you lay out the breadth and depth, if you like, of the heat experience for individuals. Quite often you see quite simple statistics on heat stress or heat stroke or loss of labor time, etc., but quite a comprehensive and broad look, if you like, about the impact of heat on people and their lives. I do want to actually say something else which struck me in your opening slides. In your opening slides, you presented the rising temperatures in India. And you also showed how they varied from year to year. And you showed the big peak years. And you described 2016 and then 2024 as the last big peaks. Those were both El Nino associated years. The 2015-2016 El Nino, the 2023-2024 El Nino. What happens during an El Nino is you get a lot of heat released into the atmosphere, and we have this global rise in temperature, which we are experiencing at the moment. So one of the things that you didn't discuss in the report, in the options for support, the safety nets, the use of insurance, etc. We also do have the potential, certainly for these really bad years, to get some sense of early warning, because El Nino allows us a bit of prediction about what's going to happen in the climate system. The other thing I thought your presentation was so helpful is the numbers of people. You know, like when we talk about things at a country level and we talk about one country, we say, oh, you know, this is what's happening in the Gambia, this is what's happening in Nigeria, this is what's happening in Fiji. You don't get a sense of the difference in population. And obviously the Indian population is a huge population, a very significant part of the world's population. And so any percentage experienced in India has huge ramifications for the numbers of peoples involved. So I think presenting it both at a country level and at a number of people involved is really, really important. Another area I thought that we could elaborate on a bit more, and you do mention it in one of your slides, is the experience that people can't sleep. We know from a physiological perspective that sleep is actually where people recover from the stress and strains of the day. And if people can't sleep, they can't recover. And so even if you set up protection systems in the workplace, ensuring that they have a cooler environment to working, ensuring, like you said, water breaks, not working in the full heat, etc., etc. You still need to think about workers at night so that they can actually rest at home. And we need to have innovations. There's the white roofs that are being developed to cool people's living accommodation down. We need to think about people not just the way that heat impacts all of their lives, but how it impacts it across the whole 24-hour cycle, not just when they're actually in the fields or in the factories. So I think if you think there are three things that are needed, you're asking about how the evidence should be taken up. And first of all is, as I mentioned, you've broadened the evidence base about what counts, really giving it that comprehensive overview, including both mental and physical health, I think incredibly important, as well as the other characteristics. We also need to make visible, as we do through our Climate Impact Awards, the harms that are being experienced and making that visible, tangible to decision makers. And the numbers really count there, but not just the numbers. I think it's also the lived experience, the voices of communities getting and enabling those voices to be heard, I think is a really important part of the process. And so listening to communities intently and understanding their experiences is where the evidence really needs to come from. It's not just an external look, see, and say, oh, this is what we think is happening to you, but really directing the research from the perspective of those who are actually living through the experience. And so, to me, the challenge is not that there is insufficient evidence that climate change is harming health. The challenge is really that our institutions, our funding systems, our decision-making processes really underestimate the full scale of those harms. And we need to measure them differently, value them differently, and fund them differently in order to respond to that. Wellcome, this is really core to what we think about, what we try and do. And I'm very appreciative of the work that you've done because it also helps us understand the processes better.
Thank you so much, Madeleine. What you've highlighted is I think it's very important, and that's the reason why we also wanted to show like policymakers in India especially that a country which is growing and growing at the back of many of these service-led industry, and if the workers within them start falling sick, it's their economic growth which is going to get impacted. So it is important for them to take the, for us, the entry point was to get the attention of policymakers by showing the scale of damage that this was doing to their GDP. Even if whether they care about the workers or not, at least they would care about the GDP and therefore then invest in their in the care and that is needed for them, especially like what we have gone and talked to the policymakers and what they always tell us is giving them 6 days, 12 days without them working. But what they don't understand that by giving them 6 or 12 days of pay without work will have a far greater impact on protecting their own economy and protecting the productivity of these workers who really contribute to making the economy. So I'll probably come back to you, Madeleine, again. But I'll now move on to Bart, whose work has really inspired me, influenced me. He is the co-chair of IPCC Working Group 2, but the way in which he is reformed or allowed for different diverse knowledge systems and evidence to come through is very important. But more so, Bart, what I really like about your approach is you keep pushing all of us, even in IPCC, that it's, we have to do something not just to look into the impact, highlighting the impact of climate change, but also the value of acting on it. What are the responses emerging? What are the best practices emerging? How can others, how can government can really act on them? So I wanted to understand from you as to, And we tried our best to put hard numbers on both the physical and mental health impact. So how do you really see some of these analyses being useful? And do you think that we should be changing or modifying the way in which we present this evidence and analysis to make it more actionable?
Yeah, thank you very much, Ritu. And I must confess that reading through the Guardian coverage this morning on the work you do, and now seeing again the presentation, it really gets to me. It is also, it's not only a factual story, it's also an emotional story. Because I scale up the immense number of people, I scale up the immense difficulty for them to cope and to find alternatives. And that is touching me. As IPCC, I definitely indeed call for the time of diagnosis. I wouldn't say is over, but whenever we do an additional diagnosis or an assessment or the current risks and the impacts or whatever, your work to zoom in on individuals, although it is a large group of it is numbers, it's immense, but that gives a much more clearer picture of what actually how climate change actually looks, feels, smells, that kind of things, by the diversification. And I guess that is also where we really want to make an upgrade relative to previous assessments, that we don't want only to have these gross numbers and numbers of people, but also zoom in on regions, on professions, on that kind of thing. So this is definitely adding to that with all that substance. And yeah, I would indeed call this, enriching the evidence base for IPCC. You rely on a lot of evidence that you collect in the field, so to say. It's not only a modeling study, it's not only a download of federal statistics. It's really going on into the grounds. And I think that's a very important contribution to also, the science itself, but IPCC can pick it up readily. Indeed, what I also like a lot is the suggestion that you make, and you have some experience as IIED with that, with what is the coping schematic for a government, or for that blended finance, insurance versus that social protection system. I think that is also very well in line with the ambition not to do the diagnosis only, but also to find where the remedy is. What I find really challenging on this, and intriguing, I must say, because there is in this solution thinking, and definitely if you think about social protection changes, or blending insurance with federal governments. I know, or at least from your report, I acknowledge the macroeconomic benefits of it. But I do not readily take the conclusion that macroeconomics is thus the incentive to act. Because there is so many other interests that actually, there will be different ways to spend that money. There will be different accountability records to actually make sure who is eligible for it, and there may be other policies that need to, for instance, intensify the industry of insurance, for instance. And so that is always I think the struggle that we have also within IPCC is that there is in a lot of particularly governmental, but also I guess more businesses or whatever, in the solution space, a lot of normative arguments need to be settled as well. And so it's not even enough to give the solution. It's also important to actually make a map of what that actually solution, how that actually competes or is enabled or is blocked by surrounding conditions that also need to be in place. And also there the evidence base is the IPCC bread and butter, I would say. If you can really show that this blended finance or this blended support system, where you indeed zoom in on, in the excessive years, that is where you rely on insurance, but in the more mild years, this is more, a more sort of generic social protection scheme. If you have numbers that can show applications that this indeed worked, that indeed you saw a reduction of exposures, an increase in the profitability of the companies that employed these workers. That, of course, is our story to tell. There is always, I guess, there is nothing wrong with bringing in a normative justification for this. And we also embrace the notion we want to work on the principles of equitability, on just transitions. We have intense discussions within the audit team what it actually is, how you actually mainstream equity and justice in our assessment. And very often it comes down for us as scientists that work with hard numbers. It's about that diversification, that explicit subcategorization of these mean numbers, zoom in on specific groups, not only look at their immediate impacts, but also look at the number of years they need to recover to actually come back from the economic fallback that they experience. That kind of reasonings is very prominently there. And that, of course, in itself has some normative element, because as soon as you start zooming in on specific groups, you have to justify why this group. But there's nothing wrong with that. But I think it would be good to have this evidence base that it is shown from practice that if you invest in this direction with this lens, with this scope to have a huge pool of potential labor hours being saved for the sake of the greater good, and if you can show that it is the case, that would give another evidence base under a very normative discussion that society needs to go through. And that is, I guess, what your report definitely contributes to. But I will keep on encouraging every author in the team to chase the literature that don't take necessarily an emotional point of view or a normative point of view, but collects the evidence that allows a good discussion about the emotions that we all feel when we see your numbers.
Thank you so much, Bart. In fact, the purpose was to, I was at the International Heat Stress Workshop that Government of India, NDMA. In fact, we missed out on having Krishna Vatsa. He was supposed to come and give an opening remark, but he said he had to leave. Hopefully, he joins later. But the whole point was there were a lot of insurance company in that workshop. And I was quite amazed as to how many, like how come it's only an insurance discussion? And even there I said, insurance is part of the solution, but not the only solution. And I'll come to Claire about this. And probably it's because some very good experimentation has already been done in India, and there are some learnings emerging from that as well. And that's why I'll bring in Claire Harbron, who is the Chief Executive Officer of Howden Foundation. And Claire, I think Howden Howden did support a scheme in India where women workers received a cash payout when the temperature became unsafe to work. And you have learned quite a lot from that experience, and it'll be useful to understand from you as to what those experiences are, and especially when we are talking about scaling up similar experiences at a pan-India level and probably in other countries as well. What is it that you would really tell us from your learnings?
Thank you so much. It's a pleasure to be here. I enjoyed reading the report this morning and hearing you present it as well. I echo all the comments of my previous panelists on, the combination of facts, reality, and kind of emotional engagement in this topic is really powerful. So yes, you're absolutely right. Howden Foundation, we had the absolute privilege of supporting Seva's excellent work in India as part of our partnership with an organisation called HERA, previously known as Climate Resilience for All. And I think colleagues from both those organisations are on this call as well today. So I'm going to talk a little bit about that experience in terms of what we learnt, and obviously we learnt via those organisations and the great work that they've done. And I think the first thing to say is to echo previous comments. Insurance is a really important solution. It's a powerful tool, but it is not and can never be the whole solution for different reasons and in different ways. So I'll say a bit more about what I mean by that. But I think the first thing, just to hone in on, make sure we're all really clear, when we're talking about insurance for informal workers, and when we're referencing the work that Seva and Hira did in India, we're very specifically talking about parametric insurance products. So we're talking about products that pay out based on a prearranged trigger. We're not talking about indemnity insurance where the worker needs to go and prove their loss and fill in lots of paperwork afterwards. And I think if we're talking about the positives of insurance for these workers, that is one of the real positives. So parametric insurance products offer, I think, a couple of things that do stand alone as really powerful. And those are simplicity from the perspective of the consumer, certainty. You know that when a trigger gets reached, something will happen, and that certainty is powerful and meaningful. And what that then gives you is agency. And Tom mentioned in his opening remarks the reality that these impacts are impacting individuals in different intersecting ways. And so whether it be through insurance or some other form of cash payout, being able to access small amounts of money that then you yourself decide what you need in that moment is a powerful moment of agency in a very volatile world. So I want to celebrate the positives of insurance as a solution, but I think we also need to be cognizant of its limits. And your report calls that out, and rightly so. It calls it out from a financial perspective in terms of the financial gap that is covered, but the reality being the financial gap that is not covered by insurance. And it doesn't cover the whole piece. It does not cover the whole risk. It does not reduce the risk. So I want to talk about two things in terms of its limits. I want to talk about the fact that it doesn't reduce the risk and the impact on you, and why it must be bundled with other solutions. And then secondly, touch on this point about how powerful it can be when it is combined with other forms of cash payout. And I want to reference a great piece of work that was done by Hira actually on the basis of this work with Seva. And it's a report that they released in 2025. It's brilliant in its simplicity in calling out very practically what they learned needs to be bundled with insurance for it to work well. And so this first point is that for it to work well, it also needs to come with risk reduction measures. So early warning systems, you talked about those as well. Simple education about how to protect yourself. I mean, no one is lying in a hot house at 45 degrees thinking, oh, well, it's fine because I'm going to get an insurance payout. That's just nonsense. You've got to be bundled with sensible passive cooling options, whether that's white roofs, they were mentioned as well, cooling stations at work. All of these things also need to be in place. And as a foundation who cares deeply about the role of insurance, we also recognize that. And if you look at our portfolio in India, we're also investing in these other types of bundled solutions as well. So it needs to be bundled with all of those pieces. But I think crucially, and this is the sort of exciting bit that I know you've pulled out, this idea of it also being combined with a cash layer. I think that's something that was trialed in this work, and now both Seva and Hira are taking this idea beyond, including to new geographies, and we're excited to be supporting that as well. So the way that it worked in India is, once the temperature reached 38 degrees, there was an option for a small cash payout, not insurance, just a cash transfer. Once it reached that really extreme temperature of 41, that's where insurance kicks in and the insurance payout comes. And Ritu, you kind of showcased that idea in your opening slides, right? So insurance should really only be kicking in for the really extreme, extreme is a relative term, but really, really extreme heat events. Other than that, it should be social protection and other, where appropriate, kind of just risk reduction and risk management measures. And we saw it work. If you look at the stats, you have some of these in your report. In 2024, 50,000 women were signed up to this program. By 2025, that was 225,000 women. That's insane scale in such a short space of time for such a new initiative. Women literally voting with their feet as they see that this works. They see that combination of simplicity, certainty, and agency play out. And in that first year, 100% of women received a cash payment at some point, and 92% of women received the higher insurance payout. And there are powerful, powerful stories of what this means to these women, and I won't try to do them justice, but stories of women who, suffered really significant health impacts as a result of extreme heat, who then would have been plunged into debt around medical bills and inability to feed their families, who were then able to have some funds to continue to feed themselves, their families, to pay off some of those medical bills. These are real life examples, and hundreds of thousands of women are those examples as this scales. If you want to hear more, because I think the stories are real and they are a powerful way of bringing it to life, we have a lovely, very short blog on our website, which brings to life the story of an incredible woman called Geeta-Ben, and Kathy Boffman-McLeod, who's a CEO of HERA, tells that story really powerfully, and Geeta-Ben herself tells the story as well. So I'll put the link in the chat. Do go and watch it and bring to life at least one example of how this works. But I would agree, Ritu. I think it's powerful, but it's not and can never be the sole solution.
Thank you so much, Claire. And please do share that link, because that is what an NGO, a small initiative, is trying to do. So that's already a proof of concept. What we are asking government and small organizations like Seva and HERA and others, now you are trying your best to prove a concept, but then it's for the government to take it to scale. And what we are trying to prove through our numbers is, it's viable and it should be done, because if it is not done, there's a huge cost of inaction, and it's quietly being suffered by the workers themselves. Now, I'll request all three of you to please be there, because we might come back and I'll seek your comment on some of the inputs from the panelists. And I'm going to slightly modify the program a little bit. We also have a documentary, but I don't want to waste the time for everyone to go through the documentary right now. I'll probably ask my colleague to paste the link to that in the chat, so we can spend more time in discussing with all of you. I'll now bring in the second panelist, Dr. Archana Shukla Mukherjee. She's the CEO of Change Alliance, and they were one of the anchor partners that we had. So I'll bring both the anchor partners now, both from India and from Bangladesh. So Archana is part of our anchor organization in India. And Archana, you've been working in this space for a very long time. In fact, I know you for more than 2 decades, so I'm pretty sure it's a long working association with you. But what the aspect I would really want you to highlight is, because we covered both outdoor and indoor workers. So especially to understand from you, what do you really think is needed to be done, especially in terms of bringing in private sector in this space of supporting the government action. So Archana, if you're still, you were on the screen, but somehow I don't see you now.
Yeah, hi.
Yeah, Archana. Yeah, go ahead.
Yeah, thank you so much, Ritu. I'm very glad. First of all, I think we were involved as part of, collecting so much of data and then reaching out to the communities. But I have never thought of in my imagination that the data will speak so much, and the kind of triangulation which has been done by IIED team is commendable. So congratulations for that to start with. In terms of because we have worked also on ground, and we are continuously working in various supply chains. So I think one very important aspect which has come out through the case studies as well, that even if people are falling sick, they're not the employer is not responsible even to make them to reach to the hospital if they are having heat stroke and all that. One, they're not realizing. Two, they do not have the mechanism. And three, they do not have the intent to, provide those kind of services, because it will have its own cost. So I think one of the very important aspect, and as you already mentioned in your presentation, that how it can be included in ESI, the employees' state insurance as heat stroke can be included as occupational disease that can provide some kind of respite to these workers. But at the same time, I think accountability has to be fixed on the private sector as well. And there should be, and we are continuously talking and working very closely with the supply chains also, how to track and trace these supply chains and not limited to tier 1 and tier 2, and how we can look into the informal sectors who are working for your factories to be part of your entire system. They are not invisible workers and they're not invisible citizens of the country. So I think that's very important in terms of how are we putting accountability. But having said that, I think you have already talked about a lot of suggestions from the policy framework. What amazed me, in fact, the glaring outcome related to the kind of you talked. I mean, the report is talking about the very limited access of and link access of voter ID card, Aadhaar card, bank accounts, access and linkage to the Ayushman cards, even PDS for the migrant workers. And cities like Delhi, NCR, and Agra and Ajmer, where we have worked on, I think these were very typical kind of outcome which has come out. So I think what was very glaring, that there has to be a lot of work to be done on ground in coordinating, in engaging meaningfully with the multi-stakeholders, and also having a lot of social dialogue and support system for these migrant workers to be part of the system. I mean, at one level, we are talking about that we have a lot of policies, a lot of instruments and mechanisms. I completely agree on that. But if it is not reaching to the most vulnerable and marginalized, then I think we are not doing something right. So I feel that it has to be looked into from the policy framework, from the private sector, looking into the entire supply chain, and also looking into the human stories within it and how they can be supported. And as the report clearly talks about how migration is impacting, and it is not at the urban space, but also it is coming from the rural setting and from the source to destination. So how to look into that and making not only the government and private sector players accountable, but everybody, all the multi-stakeholders can come together and work on it. And there is a huge scope to work on this kind of things. And I feel that everybody, including unions, including the women collectives, have a lot of role, and civil society organizations specifically have a lot of role to play to connect the dots, which is completely missing as per this study. And it's the findings are very glaring, Ritu, let me admit that. Thank you so much.
It just because as part of our research, and we also collaborated with labor unions, and they highlighted a lot of issues. And one of the recommendations that we have made there is, Government of India had a very long, elaborate discussion on how labor laws should be strengthened. And in fact, they brought together 13 different earlier labor laws and created this one law, which is Occupational Safety, Health and Working Conditions Code. And it's really sad to see that while there are heat stress related discussions happening at the government level, there is no heat does not even get a mention. There is no heat related thresholds by which the workers should be allowed to stop work. And in fact, some of the earlier laws that were there in Tamil Nadu, in Gujarat, in Maharashtra, where there was a wet bulb norm which allowed workers to get some protection in terms of once those triggers were alerted, even those are no longer there. So we really need to push and bring in some of those changes. But something that you highlighted, Archana, we do need to bring in a supply chain. We do need to enforce some of this through the private sector, through the construction companies, through these garment manufacturing companies, and so on. So that brings me to our next panelist, who's also who were our anchor partner in Bangladesh, and Shakirul Islam, who is the chairperson of Ovibashi Karmi Unnayan program in Bangladesh. And in fact, we have collaborated with them over several years. They work very closely with the migrant workers, and some of the findings that we got from Bangladesh, of course, we'll be coming out with a report by the end of this month. But I wanted to bring in Shakirul into this discussion because especially, we have seen that this extreme heat is really reshaping the way in which people live, they work, and the kind of income that they receive. So, from your context, and we have heard about some of the social protection programs, some of the labor laws in India, but from your context, like, how do you think some of these reforms should look like in Bangladesh?
Thank you, Ritu. I think it's our pleasure actually to be part of this research, and it was really interesting to see your presentation with all data and all these things. And yes, we all are talking about solutions, how we can actually make sure that the people who are affected by this kind of heat waves, particularly in the informal sectors or formal sectors like the garment sectors, how it look like. And in my opinion, I'll say that yes, the Bangladesh has some sort of social protection schemes, but it does cover the extremely poor people. It is not yet responding to the people who are affected by climate change, for example, heat stress, right? So there is no special protection system for the workers, including migrant workers, who face heat stress and other climate shocks. So it's completely missing in our country. And when we are talking about insurance, how it can cover, so we have a lot of doubts because the mass people have no trust on the insurance company in Bangladesh, particularly because that they actually do not comply with the conditions. Most of the cases, people are frustrated to run after the companies to get the insurance claims, right? So that's why it's a huge issue, even if it is in place. What I want to say, it's really important actually to talk with the affected people, how they look like the solutions, whether it is insurance, whether it is social protection, whether it is something else. We don't know. As an organization, as a grassroots migrant organization, we are trying our best to understand the sustainable solution. What can be the sustainable solution? When we are talking about, yes, a compensation for several days in a year during the heat stress can help them. But it is really helpful for the families, for the affected communities, because the heat stress is not creating the physical health stress or the mental health issues at the moment. Because of this kind of health stress, people are going through different kind of longer term diseases. And that is actually really, really concerning, that they don't have enough, protection system to get them treated, right? So I mean, we really need to think of that. It is not the instant issue. There are implications that come after a long period of time, and how the people will respond to this situation. And in our context, I mean, what I already said, the social protection, the insurance, it doesn't actually make sense for the people who are affected. And if I talk about the workers in the garment factories, they are indoor workers, and in garment sector, after the Rana Plaza incident in Bangladesh, the compliance issue has been improved, and then the government has adopted policies, and all are there in the written form. But the implementation of this kind of policies are really, really rare. Only the first category of factories, particularly the garment factories, it's very small number. They actually comply with the compliance, said by the buyers, and also according to the laws and policy. But most of the cases, the works, the subcontracting work, the garment works factories who actually work under subcontracting, they do not follow the compliances. So that's why the most of the workers, particularly the female workers in the garment sectors, they face a huge problem, and they don't have any facility to get treatment. And the facility, for example, the health workers welfare center are there, but it doesn't make any sense to the workers because the health welfare center is open from 10 to 7 o'clock in the evening, but this is the time for the workers to work in the factory, right? So they do not have any, this is conflicting the opening time and the working time at the head in the welfare center and the working time of the workers conflict. So that's why they do not take any service out of this kind of system. In the factories, there is some sort of instant first aid services. For example, they have saline water, but the saline water is not good for every worker particularly who have high blood pressure, like something. So it actually, if they take saline water during the heat stress, it create some other health issues for them, and how they will deal with that, right? So my point is like, yes, it's really interesting to know. And I also want to convince the government officials from the economic or macroeconomic perspective that how the country is being affected. But it's really important to bring the individual experiences, because this time the countries like in the EU have faced a huge heat wave, right? So if we go through this kind of heat stress, we can realize what kind of difficulties we are facing. So this kind of thing also need to consider, and I don't know how we can bring the policymakers and the government officials into this kind of discussion so that they feel that yes, the workers are human beings. So they need attention from the authorities to get support, protection, and all these things. So so I will finish with that we should not ensure only the preventive, reactive measures, that yes, people will get access instantly, but it's really important to look at the preventive measures as well, so that people go through good health. Yeah. Thank you.
Thank you, Shakirul. In fact, one of the recommendation or one of the things that we try to understand was whether medical camps are organized. Now, you would say like, why is it needed? But what we found was if medical camps are organized, then many of these workers who continue to work with high temperature, with all of those symptoms, they at least would get identified. Some of those issues would be identified and some preventative measures could be taken. And one of the ways through which it could be done is by pushing some of these private sector. At least if it starts happening in government sector, if it starts happening in construction sites, it can gradually then start getting mainstreamed. And that's why I sometimes feel that the work that Howden Foundation did with insurance, I understand insurance is not the panacea, but at least it provided a model along with the HERA model where cash transfer plus insurance. It provided a proof of concept, and it's ultimately it's up to the government to take it to scale. No individual or private entity or philanthropy can take ever act at the scale of the government, but it's all about putting the evidence there on the table. I would now want to turn to Ranjini Mukherjee, and she's a very important speaker here in this panel, because he represents something called Coalition for Disaster Resilient Infrastructure. This is again an intergovernmental organization, but a lot has been discussed today about not just the work site related exposure to heat, but also the kind of heat people experience in their homes, low height, tin or tarpaulin sheds, and so on. So, Rajini, coming to you is to understand, like, what role do you really see in heat resistant or infrastructure? What can be done at a low cost, and what can these poor workers really do at their end, or what we could push some of the private sector, which employs a lot of these workers, to do. So over to you, Rajni.
Thank you, Ritu. First of all, at the outset, I would like to thank IIED for inviting CDRI into this important discussion, and also kind of the opportunity to go through this very interesting presentation that you made. Now, coming to, I was looking at some of the key recommendations and findings from your paper, and of course, the impact of heat does not stop at the work site only. And heat is kind of a 24/7 risk and not a 8 hours occupational or workplace hazard. And for millions of people who are exposed to heat, it continues even after they return to their home. So they are exposed to kind of, because of the heat trapped within the housing, the built environment, they continue to remain exposed to the heat. There is lack of power supply, there is lack of water supply, and all this emanates from heat. So basically, when we talk about reducing the impact of heat, building resilience of the infrastructure is extremely important. And then when I say that, we have to build it at the household level, at the workplace level, and at the city level, or at the environment level or the neighborhood level where the people are residing. Now, at CDRI, which is Coalition for Disaster Resilient Infrastructure, we have been working with different governments on extreme heat management. But before getting into what we have been doing or what needs to be done, I would just like to share some data points, because I saw in your paper you're talking about economic losses. Now, what we try to do through our GIRI model, which is a probabilistic model which tries to look at the impact of various disasters and climate change on different infrastructure sectors, and we have tried to look at the impact of heat on different infrastructure sectors, and of course only the direct impact, because we are just looking at the impact of heat due to the resulting to damage to some of the infrastructure assets, and not at all the indirect losses. And that figure globally is approximately $23.9 billion. So that's the impact, and that's what I'm saying, average annual loss that will be incurred due to impact of heat on various infrastructure sectors. And when we look at the distribution across sectors, the highest is seen at the building, which is like more than $11 billion. The next is the power, where the impact ranges between 8 to 8.7, followed by roads and railways, again, some 4 to 6 billion. Now, coming to your point of what could be done, at the household level, if I start from the household level, resilient infrastructure can definitely help in improving the thermal comfort by introducing climate responsive building designs, cool roofs, reflective materials, better insulation, and of course, natural ventilation and reliable electricity. We have been working with the Ministry of Power in India and many other stakeholders to look at how we can ensure reliable supply of power during extreme heat situation. Because for us, when we say resilient infrastructure, what we meant is the system that has the capability to absorb the shock, to respond to a shock, and then recover from a shock. So it is extremely important that when there is an extreme heat situation, there might be power outage, but at the same time, the power facilities, the utilities, the power ministry should have the ability to respond to that crisis. And therefore, we are helping the government to come up with standard operating procedures and many other such measures, and not get into detail because then it becomes very sectoral. Coming to the workplace, as you said, now for workplace, again, we need to prioritize the heat resilient buildings, shaded work areas, cooling facilities, safe drinking water. And here probably I would like to highlight about the two guidelines that we have developed. One is actually a guideline for managing extreme heat management in public transport system. We have also come up with a guideline on how to manage extreme heat in schools. And third, we worked very closely with National Disaster Management Authority in India to come up with a guideline on cooling shelter, where people can actually go and take refuge when the temperatures are very high. So these are some of the low-cost measures which can be introduced at various levels by the government in order to kind of, manage the impact of extreme heat. Coming to your, the other point that I would like to mention here is also about the city level. Because when we talk about, building resilience to extreme heat, and because we work on infrastructure, I think when it is important to look at the city planning level. So we can do, there can be certain measures introduced at the design level, like as simple as expanding tree cover, blue-green infrastructure, maintaining the water bodies so that there is a cooling impact, sensitive street design, covered walkway, cycle paths and walkways, and as simple as cooling centers located in different locations. Now, that's about the existing. When you actually plan new infrastructure, what is extremely important to do a risk assessment to identify the hotspots and to ensure that we do not get into developing our assets and our settlements in areas which are highly prone to heat. So that's something could be introduced when we were talking of developing new infrastructure. So maybe if I have to sum up, I would say we need an integrated approach. We cannot just, it requires a integrated approach where we combine infrastructure design and upgrades, urban planning, governance, community preparedness, and bring all of this together to reduce the impact of, heat, both at work and at home. And as I said, to start with, it is extremely important to do a heat risk assessment and integrate that into infrastructure planning and siting, because unless and until the data is not available, if we are not aware about the risk, how much risk is embedded, then it's very difficult to design our systems. Design for for the natural ventilation I talked about, that's a simple, particularly when you're designing something new, there are ways, there are methods, there are guidelines, there are codes even available through which you can introduce such designs. And finally, I would talk about the governance, and I'll end there because there is a need for a strong governance across various levels. You need to have a heat action planning which brings all these elements together and along with capacities of the government at various levels to implement them. So maybe I'll stop here, Ritu and Bart. Thank you very much.
Thank you, Rajni. And if you could post links to some of those guidance and guidelines that you mentioned, it might be useful for all our participants. I moved to Joan Pegram, who I came to know very closely, very recently at London Climate Action Week. And I'd like to bring you in, especially to talk about what should be really done, because there's one segment we haven't yet talked about, and that's children. And as I showed in one of my slides, that many of these migrant workers, they move with children. Now, in IIED, we have a very strict protocol not to click pictures of children, but in most of the documentaries that, we had to take out some of those videos because in most of the sites, children were alongside parents and they were exposed to that extreme heat. So, from your UNICEF experience, what do you think really needs to be added on what we have done or what we are recommending? Or how could we modify or what could be really done for those children? Because children ultimately are part of the household unit. So over to you, Joni.
Yeah, thanks so much, Ritu, and thanks and congratulations also to IIED and partners for this excellent study. I think it's really important to shine a light on this issue. I think the report makes clear that extreme heat isn't just an issue for the workplace, right? It's also this health emergency. It's also a household crisis. So, children are really at the center of this. So when those informal workers, many of them are caregivers, they're coming home and there's no respite. There's no respite from the heat. There might be lack of access to water, sanitation, adequate food, and so on at home as well. And if we're zooming in on children and what this means for children, then there are sort of two key pathways through which this affects children. Direct impacts of heat for their health, for their education, for their well-being, and I'll come back to that in a second. But also through these cascading effects, these indirect effects of their caregivers' occupational sort of heat exposure, right? And I think it's really key to understand when we're talking about children as a segment of the population. And as you said, Ritu, they do generally actually tend to be a little bit invisible in these discussions, right? That is a key challenge that faces children as a large segment of the population. But also it's really important to understand that they don't experience climate impact in the same way as adults. They, because they're at this unique stage of physiological development, cognitive development, they have unique sort of behavioral characteristics, unique developmental needs. And as a result of all of that, they do experience climate impacts, including heat, in unique and disproportionate ways. So they are hit harder, and those effects do begin before birth. So I think it's really important to outline, just briefly that sort of heat stress during pregnancy, for example, we're seeing is linked to key adverse outcomes. We see evidence linking a 1 degree C increase in heat exposure during pregnancy to a 5% heat increase rather in stillbirths, and up to 16% increase during a heat wave. So these are significant figures. We're also seeing significant increases in preterm birth. So 4% increases per 1 degree C increase in temperature, and up to a 26% rise in preterm births during a heat wave. So these are quite significant impacts that we're seeing. During childhood, children also experience, disproportionate impacts. They can't regulate their body temperature in the same way that adults can. So if a newborn, for example, can't sweat. So, during extreme heat, we're really seeing that effect. They can't cool down their bodies, and that can lead to organ failure and death. So these are sort of, I would say the unseen effects, and sort of not significantly sort of taken into account in the research and literature, right? And the scale is large. So in India, we have as many as 392 million children, or 92% of the child population exposed to heat waves. And in Bangladesh, 83% of children are exposed to extreme heat. So these are large impacts. And when homes are hot at night, children can't sleep either. They can't recover. I think, Madeleine, you were talking to that sort of loss of sleep is really important, right? For all humans, but especially for children, it affects their concentration, their mental health, their cognitive and physical development, and it has that impact on their ability to learn day to day. But also there's that sort of impact on infrastructure that they require to learn. So, heat wave disruption to education. In 2024, we had a study, UNICEF conducted a study that showed that schooling for 118 million children, or at least 118 million across children at Bangladesh, Cambodia, India, the Philippines, and Thailand, had disrupted schooling in April 2024 alone because of extreme heat. So those are some of the direct effects that children are incurring on their health, on their education, on their well-being. But there are also these cascading and indirect effects, right? That we're talking about the sort of loss of workers' health, reduction on income. What does that translate to in the household for children? It means effectively reducing meals, lack of nutrition, delaying health treatment, withdrawing children from school, perhaps sending adolescents, even children, to work or to migrate to make up for household, loss of income. And there are also, I would say, that these impacts on children are large, but also not felt equally, right? So there will be gendered impacts, for example, for girls or for children with disabilities that will experience these impacts in different, more heightened ways. We're also seeing studies linking extreme heat to child marriage. And very significant increases in child marriage in certain areas as well. So you can really trace the lines from these heat-related illness, loss of productivity, reduced household income through to nutrition, healthcare, education outcomes for children. And of course, children are the workforce for tomorrow. So there are also those larger societal human development impacts. If a child is not healthy and they're not learning, then what's the long-term implications of that? And I think the key point I want to convey is really that these consequences do remain unaccounted for currently, right? So we can calculate lost wages, we can calculate medical costs, but what we're not necessarily taking into account are the impacts of a child's loss of sleep, loss of learning, loss of nutrition, loss of play, loss of parental care, emotional security, and future opportunities. So these are real non-economic losses and damages that are very real, cumulative, and shaping a child's entire life opportunities and outlooks. So that's the key kind of message I want to convey. And then in terms of the measures that we can take to protect families and children, I think many of the sort of measures have been discussed today, but zooming in from a child rights perspective, we would say, assessments need to measure the full household burden, right, of heat exposure. So using age, gender, disability, disaggregated data, we really need to capture those impacts on children's health, on children's nutrition, education, protection, psychosocial well-being as well. Secondly, protection needs to extend from the workplaces to the settings where children live experiencing these impacts, so homes, schools, childcare centres, health facilities. And what that looks like is really ensuring that the housing is climate resilient, and that they can access essential services that are climate resilient as well, the sort of essential services that they rely on to survive and thrive. And finally, shock responsive social protection. So heat triggered cash, health coverage, food assistance, income support, and making sure that pregnant women are covered as well. So these are just the key recommendations. Back to you, Ritu. Thank you.
Thank you, Johnny. They're all very, very relevant points and well taken. Probably we will cover some of those aspects in our next research. But I want to quickly bring in Karthikeyan Nagarajan, because he's the one who developed that regression model to understand, because it's okay to understand how heat is leading to those health related damages, but then what are the factors that really influence those? Like, why are workers suffering heat stroke? Why are workers suffering heat cramps or heat exhaustion? What is really driving them? So, Karthi, do you want to come in and explain a little bit about that? Because I really rushed through a lot of graphs and slides. So, I want you to explain it more like easily for people to understand what that regression model really conveyed. And I know
Okay,
we are
okay.
up for time, so I'm sorry about that.
Oh, okay. Thank you so much, Ritu. In fact, there is a question from Aaron Hong. Uh, did you consider disability factor in the study? So the question is related to that. So we have employed a regression technique called binomial logistic regression model to understand who are prone to the heat-related illnesses. Ritu has already presented the three levels of heat-related illnesses. We have a mild form, heat exhaustion, and a moderate form of the illness, and heat stroke, which requires medical emergency. These three forms. In fact, Mr. Ritu also has presented like almost all, 89, 85, 90% of the workers experienced the heat cramp symptoms, while the 65 to 70% of the workers experienced heat exhaustion symptoms, and around 50% of the workers from India experienced heat stroke symptoms. And through this logistic regression modeling, we try to understand who are prone to these three levels of symptoms. So we introduced, or we considered seven variables like heat exposure, whether the people who are workers who outdoor workers or indoor workers, or the workers from the high hotter regions or the mild hot regions, and workers with high physical labor intensity and workers with less physical labor intensity who are born, and whether the safety measures available at workplace affect the heat-related illnesses, and housing conditions. Very importantly, most of the studies do not consider this, but in our research, we have specifically found out some important insights. Whether the housing conditions contribute to the heat-related illness conditions, and the practice of coping actions. The study findings, the regression model findings were quite interesting. So, in terms of heat cramps, almost all of them, all the workers, whether it is outdoor worker, physical intensity, housing, almost 80-90% of the workers were experiencing heat cramp symptoms. But there are two significant variables. Workers doing physically demanding jobs or high intensity labor jobs were more prone to heat cramp symptoms. And very interestingly, people who followed or adapted coping measures, their informal coping measures, were less prone to the heat cramp symptoms. But the contributing factors for heat exhaustion and heat stress were almost similar. Uh, the people, workers living in hotter climate zones, workers doing high intensity labor works, workers living in poor housing conditions, which are prone to the heat, and aged people, at least particularly people above workers above 45 years age, and very importantly, specifically for heat stress conditions, the availability of uh, better poor workplace conditions contributed to heat stroke conditions. So these conditions contributed to heat exhaustion and heat stress. So to sum up, there is no difference between outdoor workers and indoor workers. Most of the research works so far have considered the outdoor workers, but in our research, we have specifically found that irrespective of the heat exposure, whether it is indoor or outdoor, during summer months, the workers who are involved in physical labor are prone to the heat-related illnesses. And as the level of heat related illnesses from heat cramp to heat stroke, structural factors like housing and availability of safer conditions contribute more towards this heat cramp, heat exhaustion, and heat stress. So these are the findings. Thank you.
Thank you so much, Karthi. Basically, you see, the reason why we did this regression is like we do need to understand that the factors driving different type of illness, only then we can address them. So do read our report, and I'm really thankful to all our partners, especially the grassroots partners who work because data collection a lot of time meant that they had to do it beyond the office hours, and we are really thankful for them to have shown that commitment and worked with us. I'm also very thankful to all our panelists, and especially people like Madeleine, who I know uh, personally, because they are doing a lot in this space, and I really appreciate that. I put that at very high level because we keep talking a lot, but a few organizations are really going out and doing something, and I really put that at a very high level. Again, people like Claire, who went out, who had the courage to go and experiment something and do, and all the partners along with you who have tried to do something and proven the concept. It's up to government now to scale it up. We are also thankful to Bart, because I know at IPCC level he's trying to do something different, to Archana, to Shakirul, but also to Rajini. And I hope, Rajini, we can work with you at CDRI to scale this whole initiative or disaster resilient infrastructure, both at the government level, but not just in India, but in other country contexts where CDRI is working. And to Joan, definitely, we will make sure that our next research really focuses on trying to quantify some of those intergenerational, the cognitive damages that heat or other climatic impacts are creating. So thank you so much, and I hope we can continue to work together, because as I said, this is not an issue that IIED alone can handle. All hands on deck is needed. So I would really appreciate that if we can work together in future and try to come up with some innovative solutions to these pressing challenges. So thank you all, and see you soon. Bye bye.